Welcome. I'm Dr. Deuk. We're broadcasting live spine surgery. Our patient comes from Canada. He has Piriformis muscle syndrome. What is that? And it's basically a torn muscle in the buttock, and it's a very common cause of back pain. The pain is characterized by very severe sharp pain in the top of the buttock. This patient has that. When you examine somebody with Piriformis syndrome, you push on the top of the buttock and they have tenderness there. Now, they can also complain of sciatic pain down their leg because the sciatic nerve runs either through or below the piriformis muscle. And when the piriformis muscle is torn and inflamed, it's going to hurt and it's going to cause inflammation of the sciatic nerve if the sciatic nerve is nearby, which in most people it is. So what do we do, Henry? We go in and we do a release. That's a permanent way to get rid of Piriformis syndrome. We've tried physical therapy. We've tried injections of lidocaine, steroids, and PRP and stem cells and Botox. We've tried everything, all different kinds of treatments, all right? And those treatments will help for a little while, but they never take the pain away permanently. The only way to get rid of this pain permanently is to actually go in and release the muscle off the top of the greater trochanter, right in the piriformis fossa. Let's show the audience our video on how this is done.
A piriformis muscle tear can cause lower back pain and sciatica. A piriformis muscle injury causes a tear, in which piriformis muscle inflammation causes back pain. And also, piriformis muscle inflammation may cause sciatic pain. The best treatment for piriformis muscle syndrome is the Deuk piriformis release. From there, the piriformis pain is permanently eliminated. The advantages with the Deuk piriformis release is that it's an outpatient procedure, which would take up to about 30 minutes. Minimal bleeding and pain after the procedure with an immediate recovery and return to work the next day, as well as a 99% success rate with permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
And welcome back. We've just completed the piriformis muscle release here on the patient's left side. And boy, it sounded like Velcro. We were releasing so much scarred, tight fibers of the muscle. As you note, he's also had the laser surgery for a L5-S1 disc that was painful. He's had bilateral facets, left SI, and now the left piriformis. So how many causes of back pain did he have? Well, let's count it up. He had the disc, so that's 1. The 2 facets, that's 3 so far. Then the SI is 4, and the piriformis makes 5. So we had 5 things causing his back pain. Let me have the marker. He had 5 causes of back pain. The average patient that comes here has 4. He had 1 more than the average. And when we tested his disc, he had 9 out of 10 pain. It was concordant, meaning it's typical back pain. But on exam, I knew he also had facet pain, SI pain, and piriformis pain. Piriformis now is going to be treated, so is the SI, facets, and the disc. So I expect him to be doing fantastic. He'll have a little pain from the surgery, goes away in a couple of days, but he's going to do really, really well. Now, take a look at this scar right here. This is the scar from his fusion. Okay, this is the white scar. You guys can see it. It's huge. This is, I don't know, how big is this? Okay, look at that thing. That is, if you look at it, that's about, 7 inches. 7 inches. And of course, he had that major surgery, was in pain for months with the fusion, and it didn't even work. It looks terrible on the MRI, but I don't think it's causing any problems for him, hopefully. And I don't see any evidence of infection from his fusion, but we know where his pain's coming from. Deuk Spine figured it out, and we just fixed it for him. So he'll go back to Canada a happy man. All right, thanks everybody. Great job. Any other questions?
No current questions.
We're going to end the stream. We'll be back shortly with another